Back now to our coronavirus coverage. British health officials issued a new alert today saying people who have had a significant history of allergic reaction should not get the Pfizer-BioNTech COVID vaccine. The precautionary advice comes after two members of Britain's National Health Service experienced allergic reactions after getting that vaccine yesterday. Both are being monitored and they are recovering. The head of the UK's medical regulatory agency said this is really not an issue that was noticed in the clinical trials.
But if we need to strengthen our advice, now that we've had this experience in the vulnerable populations, the groups who've been selected as a priority, we get that advice to the field immediately.
Tomorrow, an FDA advisory committee could grant emergency use authorization of the Pfizer vaccine here in the U.S.
Yeah, but before that, we want to talk about the potential risks with Nurse Alice Benjamin. Nurse Alice, what do we know about the side effects of the COVID vaccine?
Well, first off, let me say side effects are things that are more of a nuisance. These aren't things that are necessarily life-threatening. And from what we know of these vaccines so far, the most common side effects that we anticipate are fatigue, headaches, chills, some muscle pain, joint pain, and some diarrhea.
Now, how soon after getting the vaccine can people expect to see these side effects? And could they be strong enough that someone might feel the need to take a day off work?
Absolutely. When it comes to side effects of medications, it's a little different in everyone. For some people, it can happen right away, and then sometimes it can be delayed almost up to 7 days after administration, as it's been with other vaccines. Our biggest concern, though, and which is why after you receive a vaccine, which you will also need to do here, is you'll need to be supervised for at least 15 or 30 minutes after your vaccine, because what we're most concerned about is that life-threatening anaphylactic reaction. And when that happens, it usually happens pretty quickly. And that is when we have like the low blood pressure, the shortness of breath, things that are really life-threatening. So we want to monitor you after you receive a vaccine and for those life-threatening ones. But some of those other ones that I mentioned, the fatigue, the headache, and those things, those can actually happen maybe a day after. And you might feel a little lousy the day after, but that means that the medication is working. It's actually causing the response in its bodies in your body to build the antibodies you need for this coronavirus.
Oh, at least one of the vaccines requires a double dose here. So do you think people won't go back for the second shot if they had a bad experience with the first time?
Yes, and that's going to be one of the challenges with this two-step vaccine. If you had one vaccine and it didn't make you feel well, most people are less likely to come back for that second dose. However, what we do know from the studies is that of the severity of the side effects, most people, the first one, not too bad. It's the second vaccine where most people had more of the side effects that were reported.
Nurse Alice, how long do you think it will take before everyone who wants one of these vaccines can get one? Because we know the first set of shots that are going to come our way are going to be for healthcare workers, and there's not that many coming.
Right. Well, so we want to address the vulnerable population first. But now that we have this new information about, these two cases, we want to be very diligent. So, in the UK, they're actually made some recommendations of increasing the wait time after you receive a vaccination. They've also made some recommendations that perhaps vaccines should only be given in places where they have resuscitative equipment. They're also identifying that perhaps people who have severe allergies currently to medications or foods, or who may be allergic to any of the components, maybe not be in that first batch. So now that we've seen this in the UK, this is actually, I'm sad that this happened, but it's going to be very helpful for us in helping to redesign our rollout. So actually, Carolyn, with this new information, I anticipate it might slow things down a little bit, but it's because we want to do things safely.
All right, Nurse Alice, as always, we appreciate it. It's all eyes on the UK, at least right now. Thank you.
Yes, thank you.